Thank you very much. As I say, welcome everyone. I'm Greg Mitten, lay member, Public and Patient Involvement, NHS West Lancashire CCG. We are once again having our AGM virtually in the wake of COVID-19. The draft minutes of our last AGM are available on our website, www.westlancashire.nhs.uk. Any questions that were pre-submitted ahead of the AGM will be answered as part of this session. And if you have any further questions that occur to you during the presentations, would you raise them via email directly to wlccg.myview@nhs.net, and they will be answered after today's meeting. The chat facility will be available at the end of the meeting or the presentations, should you wish to enter any questions that occur to you during the presentations. Before I call on our first speaker, I would like to welcome our Interim Chief Officer, Andrew Bennett, who is joining us today for our AGM. So without further ado, could I ask our first speaker to come forward, Paul Kingham, our Chief Finance Officer and Deputy Chief Officer of NHS West Lancashire CCG.
Thank you, Greg, and thanks everybody. Good evening. I'm just going to talk through some of the finances, but before I do, if we just go on to the next slide, I just want to make people aware that our annual report and the accounts are on the website. And actually, if you Googled West Lancashire CCG Annual Report 2021, you should get the nice glossy document that's been produced. So that will give you a good idea on some of the detail behind some of the schemes that happened last year in the CCG, particularly around things like cancer, maternity, diabetes, etc. Obviously, we can't cover all that detail now, but I would recommend the annual report as quite a summarised read, which is quite easy to follow. Okay, so next slide, please. This slide, for those who've been to the meetings in public when we were allowed to do the village hall meetings, will know we often start with this type of slide, which just explains our unique geography. We're quite a small CCG relatively to the other ones in Lancashire, but we do think that gives us quite a strong sense of identity, and we certainly don't want to lose that as we move forward through the changes in NHS that are going to happen over the next 6-12 months. We have 15 practices. We've got a history of collaboration in West Lancs. We've got 3 neighbourhoods: Ormskirk and Orton, Skelmersdale and Burscough in the northern parishes. Incidentally, they are also the footprints for our primary care networks. So again, primary care working together on local issues, as well as working as part of the bigger Lancashire strategy. The funding allocation for last year, or the last financial year, was 193.5 million. And I'll come back to that in a minute, but that equates to about £1,700 per person. Okay, next slide, please. In terms of the financial duties for last year, it was a very challenging year. We're going to come on to more detail around the COVID response, but I think everybody's lives are being turned over really by the COVID situation. And from a financial point of view, we were actually faced with a new financial regime during that time. Obviously, the government had to make some changes to the finances, and we were effectively suspending contracts with hospitals to make sure that we could get money to the front line. However, we have recorded a break-even position with our financial results for last year. I'd also like to say that we managed within our resource limit. We achieved an unqualified opinion on the accounts. And what that means is we expressed a true and fair view for the accounts, and the auditors were happy with what we produced. We also achieved a clean value for money opinion. So when they looked at our economy, efficiency and effectiveness, they didn't find any issues with that. We managed within our resource limit for running costs, which means that we managed our staff budgets appropriately and within limits. And importantly as well, one of the initiatives that the government were keen to ensure was that we spent more on mental health, and that we continue to spend more on mental health each year, which we managed to do. So we achieved the mental health investment standard. And finally, I'd just like to make a point on the finances that, you know, in that difficult year last year, we know that many organisations in West Lancashire and across the country were struggling, particularly businesses. And I'd like to just say that we paid all our creditors, all our suppliers on time within 30 days. And so we hit our better payment target for 2021. Okay, next slide, please. In terms of how we spend the money, so if you remember, it's 193.5 million. You'll see that the lion's share of that goes across the acute sector. And the biggest part of that is Southport and Ormskirk Hospital, our main provider. But we also have providers both in Merseyside, Manchester and Lancashire. So for instance, our next biggest contract is in Wigan. So we try really hard to make sure that we form relations across both the Merseyside system and the Lancashire system and the Manchester system to make sure that we bring the best value for patients and that we understand patient services from the patient point of view. In terms of the actual spend, 193.5 million, it's actually 10 million higher in that particular year than the previous year. And that's mainly because of the COVID pandemic. We had recourse to the government for extra resources that covered primary care, digital spend, making sure that we could get patients out of hospital as soon as possible safely. And the total of that was around about 10 million. So that's why the budget's gone up so much during that particular year. Okay, so next slide, please. I would just like to hand over to Dr. Peter Gregory, our chair, for a little bit more detail on the COVID response, given the significant efforts that were made over the last 12 months.
Thank you, Paul, and thanks for that introduction. So if we can take the next slide, please. So we're starting off with a lovely picture of an Ormskirk resident, Barbara McCarthy, who on the 16th of December last year became the first person in West Lancashire to receive the COVID-19 vaccine at Hants Lane. I'm sure you're all aware and you've heard that this was the beginning of the biggest and most highly anticipated immunisation campaign in the history of the NHS. Next slide, please. The objectives of the vaccination programme were as determined by the Joint Committee on Vaccinations and Immunisation, a national body, and the focus was primarily on reducing population mortality or death from COVID, but also to reduce significant illness admissions, and of course to protect health and social care staff and systems. The first phase, therefore, focused on the most vulnerable members of our population and those with the highest risk of developing serious complications from the virus. We can show this in the next slide, there where we can see the three key phases of the programme. So towards the start of the winter last year, we focused on those most vulnerable, so residents and care homes, those over the age of 80, and then moved through age order down the age profiles of the population. As we moved into phase 2, this was around about spring going into summer of this year, we're starting to hit the more kind of the healthier members of our population, moving into the younger people. And currently we're continuing to work through these groups. Most recently, with the support of other partners, we're moving into the 12 to 15-year-olds in the schools. As we finish off the latter stages of phase 2, we've actually begun phase 3, which is the booster program. This will be representing a third vaccine for all those that have already received the first 2. And this can actually be co-administered with the flu vaccination. So trying to get people double protected as we go into what we're expecting to be a difficult winter. Next slide, please, Luke. So you may or may not be aware that the vaccine rollout has primarily been led by the GP practices themselves. They're organised into 3 primary care networks. The first in Ormskirk, based at Hants Lane. Skelmersdale have been delivering the vaccine via Burleywood Health Centre, and in the north, the Old People's Club in Berscough has been the hub for the vaccination delivery. However, we've also been supported by a larger scale pharmacy-led site at Edge Hill. Some of you may have passed that as you're in and out of town, operated by Aspire Pharmacy. And between us, we've delivered over 170,000 vaccinations in West Lancashire to date. Next slide, please, Luke. However, we're very conscious of the fact that not everybody has the means to get to those vaccination centres. And so to combat that, and also to focus our efforts in areas where we've noticed low uptake, we've had a series of pop-up clinics all over West Lancashire, and we have been supported by West Lancashire Borough Council and Lancashire County Council in the delivery of these pop-up clinics. Goes without saying that there's been a number of people who have supported the vaccination efforts. We've tried to list some of them there, but it truly has been a multi-provider, multi-speciality collaborative effort from all parts of the system, not least general practice, hospital, communities, public health, local authorities, the Lancashire Fire and Rescue, voluntary sector, all the volunteers we must make reference to, who've been fantastic in the hours that they've given, and even the police have been very supportive in the early days. So it's a big thank you to all those that have been involved. Just to move on from the vaccination effort, it's just worthy to mention that primary care has been working hard throughout this period. You're all aware that the demands and the difficulties getting doctors' appointments, and we just wanted to remind all that primary care continues to work incredibly hard, although the way in which and the manner in which primary care is delivered has been a little different. GP practices are open and continue to provide services as they have done throughout the pandemic. This means that for patients, the GP practice is open and providing GP services, be it remotely, using telephone or video technology, or face-to-face if safe to do so and deemed necessary by the GP. Next slide, please. Also, just wanted to remind all of the prescription ordering direct service. This is a service that's available for all residents of West Lancashire, and it represents collaborative efforts from the practices to provide a capable system for ordering prescriptions. It is open Monday to Friday throughout the day. It is available in a number of ways, acknowledging that residents may have different preferences for requesting their prescriptions. So if they're willing and able, they can access it digitally through smartphones or computers via that website. But also there is a phone number that residents can use should they wish. Okay, I'm going to hand you back, I think, to Paul.
Okay, thanks, Peter. It was just to, in this section, what we thought we would do was just make everybody aware of, it was a good opportunity to make everybody aware of some of the changes that are happening across the NHS at the moment. Obviously, this will directly affect the West Lancs CCG. So we can go to the next slide. So at the moment, we operate as one integrated care system, an ICS. We're currently the Lancashire and South Cumbria Health Partnership. We've been working together across Lancashire and South Cumbria for some years now, but obviously some of the changes that will come in will make this more of a statutory footing. So the ICS system is a partnership of NHS, local authority, public sector, voluntary, faith, community and social enterprise. And that will cover the population of 1.8 million across Lancashire and South Cumbria. Okay. The other thing that is part of that and certainly works alongside the bigger Lancashire and South Cumbria footprint is the 5 places, of which West Lancs is one. So you'll see on this map here, there's Morecambe Bay, Pennine Lancashire, Fylde Coast, Central Lancashire and West Lancs. So we will still have our own identity within the Lancashire and South Cumbria footprint. The reason why we work both separately as our own identity, but also as part of Lancashire, is that some of the patient issues will be at a higher level where it makes sense to do so, and some of the patient issues will be at a local level. So again, this is all about where is it best, where are we best able to make those decisions. The other thing I've just bear in mind when I'm saying this, we've had a question in from somebody which says, our CCG in West Lancashire have made every effort over the years to engage with residents. In the light of the reorganisation that appears to be, that appears to be leaving West Lancashire in a no man's land at present, I would like to know what your message is to residents who are concerned about the future of accessible hospital provision for residents in our area. So I think what I'd say, and we've got some more slides that we'll tease this out in the next few slides, is that the West Lancs partnership will remain. So even though the CCG will be part of a wider ICS body, the local partnership will be developed, and that will still include a number of stakeholders that have been working together over the last few years. So, for instance, the GPs will continue to work with community services, work with the local social care teams, and work with the local hospital, as well as the voluntary and faith sector on West Lancashire issues. And they'll be supported by the wider Lancashire and South Cumbria programme. So as I said before, where it makes sense to work local, we will do. And certainly the primary care networks of GPs are looking at those individual patients' issues to make sure that the characteristics of those populations are brought forward and that we make progress on some of those issues. So to give you an example, where I live in the northern parishes, we have a higher elderly population. So the GPs in that particular area are looking at services which might serve better the population for elderly people. And in part of Skelmersdale, we have quite deprived areas which require perhaps a different set of services. So again, none of that is going to change. We can actually build on the work that we've already done, and the partnership should actually strengthen some of the work. So I'd just like to reassure the member of the public who wrote in with the question to say that the partnerships will establish a very, very strong identity and will have a direct link to the ICS, or the Integrated Care System body, both for support, resources, staff resource and money. So it was just to give that reassurance while we go through these slides. Okay, next slide, please. Where are we now? And this slide is basically saying that we've been working on these issues for a number of years. We recognise that the COVID challenge has exacerbated some of these issues, particularly around health inequalities. And we will work together as part of the Lancashire system to try and solve some of these. But where it makes sense to do that locally, we'll still do that. So we must be bold in our collective efforts to solve these problems with urgency. And I think that's something that we're all keen to do. So where we need to, we will play into the Lancashire programmes, and where that doesn't make sense, or where we need to work with Merseyside, we'll do that as well. And I know we've got something in the slides at the end where we talk about how we're working very closely with the Southport system. Next slide, please. Just to give you an idea on where the legislation is up to, in February 21, the white paper was published, which brings in the changes around the statutory organisations and will mean the current CCG will be absorbed into the Integrated Care Board. The legislation currently is at the committee stage in House of Commons, so it's being debated and scrutinised, and we expect it to be approved over the next few months, which will mean that the new Integrated Care Board will be established from April. Next slide, please. So there'll be a new NHS organisation operating across Lancashire and South Cumbria. It will be a statutory ICS called the Lancashire and South Cumbria Care Partnership. So at Lancashire and South Cumbria level, there will be a partnership of organisations, not just in the NHS, but across social care and the voluntary sector. And they will have a legal footing. And to a certain extent, that will be mirrored at local level as well. And there will be arrangements to make sure that decision-making transfers to the local place where it's appropriate. And it's again just making that point at the bottom of the slide that where things are best done once across system level, so a wider footprint across the 1.8 million people, we'll continue to do that. And it just gives some examples there, like specialist mental health and ambulance services, where it makes sense to work together across Lancashire. Next slide, please. Just going back to the question that the member of the public raised, this just puts in a bit more detail. So we know that places, and we're developing this at the moment, will have a strengthened role to improve population health. So working with the GPs and the community services to look at those individual populations and reduce health inequalities. Places will be supported by the Lancashire and South Cumbria Health and Care Partnership, so we won't be working on our own. We'll have the support of the wider system. There'll be clinical leadership at all levels and engagement. So we'll retain local GPs in the local system who will be leaders understanding the place, but we'll also have representatives at the Lancashire and South Cumbria level influencing programmes, like I said before, like specialist services and ambulance services. So we'll have a say in both camps. Places will lead the role for primary and community services. I mean, for those who know the West Lancashire identity, for a long time now, we've focused on primary and community as the backbone for how we develop services. And certainly the primary care networks will give an even more strengthened role for primary care in shaping how local services are carried out in those neighbourhoods. We also will have delegated budgets from the new larger NHS organisation. So those arrangements will mean that we can influence where that money goes, and there'll be decisions made around that with partners. Next slide, please. We see engagement as a massive part of what we need to do. I know Jackie's going to come on to how we're doing that within the Shaping Care programme. But we see this at all levels. So local engagement with the public, with councillors, with the voluntary sector, with all of our service users to make sure that we shape things in the right way. So there'll be engagement at neighbourhood level, there'll be engagement at West Lancs level, and there'll be engagement at the Lancashire level where it's appropriate. Next slide, please. So the next steps, like I said before, the bill is set to be go through the next stages in Parliament over the next few months. We need to make sure that colleagues, partners, residents, members of the public are informed about the developments, and I guess this is part of that information. We thank all of you. Everybody's working so incredibly hard, doing an amazing job. We know it's a really tough time to be doing this, but we think it's the right thing to do. And we're really keen to make sure that we involve all of our stakeholders and members in the public in the conversation around this. If you want to find out more about some of these changes we are developing, please visit healthier well, I won't read it out because I'll get it wrong, but you can see on the screen there, there's a website address that you can go on to that will give you more information. Or if you want to write to anyone in the CCG, we'll be able to send it to you. Okay, I believe I'm handing over to Jackie now. Thanks, Jackie.
Thank you for that, Paul. Thank you. So I'm just going to cover Shaping Care Together as one of the engagement pieces of work that we have been doing this year, and it is one of the most important, I think, strategic pieces of work we have been doing alongside, you know, other work the CCG undertakes. Next slide, please, Luke. So this, sorry, can you just go back one, Luke? Sorry. This is very much about sustainable futures of our hospital services, and it's making sure that we've got those services for the residents of Southport and Formby and West Lancashire, those that access Southport and Ormskirk hospitals. And, you know, in doing this, we've made sure that we've got our clinicians, our chief nurse, GPs involved in this process to influence it. And I've taken the role as a responsible officer for the engagement. But I just wanted to be clear that statutorily we have to go through an engagement process. We have to then go through consultation if what we engage on results in significant change. But where are we currently? We are at stage 1, and that is about listening and engaging with our residents. And that's what we've done since the start of this year. And I suppose what I'm going to show you here is just some of the findings that we've got, and then maybe talk about where we go afterwards. Thank you, Luke. Okay, so some of the where are we currently with our engagement? Well, we had a bit of a false start, I'll be honest, with the questionnaire. I think that we started originally. I think we got feedback from our residents that actually said the survey's far too long, and that doesn't suit us, and we weren't getting the uptake. We listened to that, we changed the questionnaire, and now we are getting some really good responses coming in. So you can see we've got about 2,000, of which 1,700 is on this new questionnaire. We have lots of people visiting the site, and we are getting in to get some more information from our staff around what the staff think is currently their experience of working in the hospital and their services. We're producing staff newsletters, and that's gone out originally to 300 stakeholders. Our list now is up to 500 stakeholders, because as we go out and engage, we're engaging with more people and finding more people interested in this. So it's going out far and wide, these newsletters. We're working on an issues paper. So what is wrong? Why do we have to do what we're doing now? And what might be the opportunities? So that's in development. And we've got frequently asked questions and focus groups that are underway. And we're asking people if they want to be kept informed. So again, that's how our stakeholder groups are increasing. Next slide, please. So what we tried to do with the questionnaire is to ask some questions that would really help us to shape the model of care and influence, you know, what we were going to do based on what our residents told us. So some of the themes that we're actually finding here, 70% of those that we've asked favour telephone or video appointments. They want shorter waiting times for outpatients, and they're happy to travel if that means they get the best possible care. 85%, you know, would travel to a specialist centre for complex treatment, but 94% agree that healthcare should be provided locally, but you know, locally where possible, but specialist where necessary. So all of these findings will be considered and are being considered in options as we develop going forwards. Next slide, please, Luke. We've got some feedback as to what people are finding good in our health economy. So they like the urgent treatment centre in Ormskirk. They like the A&E in Southport. They like the prompt appointments for planned procedures. And they do find our staff caring and compassionate, which is, excellent to know. They are saying that they find joined up services between both sites, between Southport and Ormskirk, which again is very good to know. Less good, we're hearing that the A&E is overwhelmed, and we've definitely seen that through COVID, when actually it's been restricted in terms of space. Staff shortages in certain areas, which I think again we've all experienced during COVID crisis, and public transport links for some of our residents that are coming from the more rural areas. Actually, it is harder to get to some of these hospitals. So we need to take all of these into account as we're thinking about our options. But I just wanted to, before we move on, Luke, I just wanted to be clear about the public sector equality duty, because we're not just taking these at face value, these comments and the findings that we've got. The public sector equality duty means that we have to delve down much more deeply into the findings that we're finding here, and understand who has responded and who has said what in those findings. So what we've heard to date is actually that we've got far more women responding to these questionnaires than we have men. That's generally the case in terms of questionnaires, but for us, that's really important that we now get out in the next round of engagement and really trying to get some of our male residents across across West Lancashire, Southport and Formby, and hear what they think of these services. We've also heard that there's very few under 19s currently that have responded to this survey. And again, because we are talking about children's services, we need to understand what these services mean to them. So we will get out and have some more conversations with those. And finally, we've heard things like disabled people really value face-to-face appointments. So although I've said that people, are accepting of video consultations, disabled people are saying they prefer face-to-face. So it's those sort of things, and it's that level of detail that we're actually getting into to make sure we've got geographical spread, demographic spread, and we're covering all the different characteristics across our patch. So Luke, could we have the next slide, please? Thank you. So again, we have some more feedback on staff on the UTC. And yeah, so we've got some numbers there. But again, we've got into far more detail around who said that, where are they from, what characteristics do they have. Next slide, please, Luke. Okay, so these slides were written at a point in time. Actually, things have probably moved on since these slides were written. The engagement process advisory group is established now. They have met once. We did have another meeting penciled in. Unfortunately, we had some changes and that hasn't met, but there is plans in place to put that in within the next month. We are going out for more surveys and we are going out to get more feedback from staff. But one of the changes that has happened in recent months, actually there has been the strategic partnership announced between Southport and Ormskirk and St Helens and Knowsley hospitals. That's a long-term strategic partnership with St Helens that is an excellent CQC rated hospital, is coming in to support Southport and Ormskirk hospitals around fragile services and seeking options to actually look at how they can make those resilient for the future. So where we are currently, although we had plans here to take forward those next steps, what we need to do is pause slightly so that we understand and can work with St Helens and Knowsley and Southport and Ormskirk to understand what direction St Helens and Knowsley and Southport intend to go with some of those fragile services and how that might affect what we're doing with Shaping Care together. We currently have models of care. So alongside the engagement and the process that we're doing with our residents, we have our clinicians working together to think about what might be the direction of travel of these models of care. What we'll need to do is look at how the working of Southport and St Helens as they come together, how we might want to include that and how that might affect those models. Alongside that, we're also We're also looking at our out of hospital strategy. We're working with our PCNs around their clinical strategies and what we're going to do in each of those 3 neighbourhoods that Paul's alluded to, and what estate strategies they are there, and where we're going with those. Similarly, not only are we working with our PCNs and with Southport and Ormskirk, but we're also working with the new hospitals programme across Lancashire. We're really conscious that there is that piece of work happening with Lancashire Teaching Hospitals and Morecambe Bay Hospitals to look at what new estate they may need. And we're really conscious that their service strategy needs to align with our service strategy, and make sure that there are neither overlaps nor gaps for our residents. So again, we are involved in that modelling and the work that's happening up there with the New Hospitals programme to try and make sure our residents get the right services in place. So that's it. Luke, I think mine is then the last slide. And I think, Greg, I hand back to you.
Yes, thank you, Jackie. Thank you to all speakers. Thank you to everybody who's attended this evening. And as I said, if questions have sort of risen with you during the course of the presentations, please do email them into us, and or pick up the phone to the CCG, or for the next few minutes the chat section will remain open if you want to lodge a question there. But other than that, thank you for attending. Thank you for the staff that have spoken and for those that have helped prepare the reports for this evening. And I think I would sort of leave it with a thank you from Dr. Peter Gregory in terms of having gone through and still going through the pandemic experience. It's just a thank you to all of the stakeholders for West Lancs, including our community residents and volunteers that have done so much. Please keep in contact, but thank you for attending.